Hi, I'm Beth from Manx Radio News. Now, something that's been in the headlines this week is the future of Cummal Mooar in Ramsey. According to Manx Care, the facility will close in the next 2 years and plans to construct a new home to replace it will no longer be going ahead. I should say at this point we have invited Manx Care for an interview, but they have declined. Now, the Health Minister Lawrie Hooper has a slightly different take on this, and he's been talking to Christian Jones.
They're not proceeding with the original proposed plans. Actually was a Treasury decision rather than a Department of Health or Health and Care decision. So last year we submitted an updated business case to Treasury outlining the plans with the extra costs that were going to be incurred. That wasn't approved as part of the budget process. Instead, we were sent to what's called the Project Development Fund to rescope and recost the work. So as part of that, we took the opportunity to say, actually, OK, if we're going to do this anyway, then we may as well look at what the need is and whether or not what we're proposing to build actually is going to match the need. So that this is a long-term planning decision. This is something that has been on the cards for quite some time, but actually, just like to reconfirm for the avoidance of doubt, the plan is still very much to replace the facility in Ramsey with another facility in Ramsey. It's just the exact scope and size of that facility is yet to be determined because we haven't yet finished going through those Treasury processes.
So when was DHSC actually aware that the health body was going to be closing it before the replacement was built?
So that's another interesting question. So that is something that has not come up in conversation. So what it boils down to, I think, is under the way that the current processes work, originally the plan was to have the new facility built and up and running, obviously, before the Cummal Mooar was closed. Because of the Treasury decision to send us down this project development route to kind of rescoping and recosting of the work, where we've actually ended up is pushing those timescales out. So I myself believe, and it is the department's position, that the current facility shouldn't close until the new facility is available. That would be the most logical position. So that's basically what I've spent most of my day today talking to Manx Care about, is how we can make sure that that is the case.
And Manx Care has blamed the cost of the construction for one of the factors in not proceeding with the plans, and it says it would be around £13 million, which is around about double the initial estimate. When the plans were submitted in January last year, as you just mentioned, the anticipated cost was £12.75 million. Do you think it's disingenuous to use cost as an excuse when the position was known more than a year ago?
So again, the original build cost, I think, was around about 7 point something. Was the original business case that went to Treasury. And so the situation is, as I've outlined, when we did put the business case to Treasury, including these increased costs, Treasury declined the business case and instead sent us down the project development route. So whether your views on that are okay or not, actually the position is what it is. We've been told to go away and rescope and recost as part of that project development work. That's what we're doing. So whether or not the cost increase, like I think you've outlined, it is quite substantial from the original 7 million to I think nearly 13 now. It is a big cost increase since the project was originally undertaken and the original business case was approved. So it definitely is a factor. But like I say, it was that decision not to approve the business case that triggered this need to then look at the scoping and the size of the facility to make sure that what we are going to go back and build is definitely going to be the right thing.
So obviously the building of the new home was approved by the DHSC in 2018. Obviously that is some time before you became the health minister, but can you offer any explanation as to why it's taken 5 years to get to a position where the plans for the project have been shelved?
So extremely long capital processes. We all know that where government is, it takes quite a long time to get anything through the capital process, especially when there are cost increases and changes. So you have to keep going back through the process again and again, almost to get those approvals. And I would like to reiterate that the plans to replace the facility have not been shelved. It was the originally proposed plans are now going to be different. So there is still very much a commitment to replace the facility.
It's been stated that analysis of the future direction of residential care has shown that facilities like Cummal Mooar will not be so widely required going forward. That sounds like a policy decision, so would be your remit. I mean, who has conducted that analysis, and is there any evidence to show these facilities would not be as needed, and where can that be reviewed?
Yeah, so there is quite a significant amount of evidence from pretty much all over the world, actually, that the direction of travel in respect of long-term care is more about keeping people at home for longer. So if you look through our department plan, for example, we've published this quite openly in the department plan, talking about more care at home, right care, right time, right place, less of a demand then on what you would currently do in terms of residential and nursing care. I think it is fair to say, though, that what we are seeing is there will be an increased need for specialist care. So that's long-term nursing care or dementia care. That is on the increase. And so the reality is what we need to build are facilities that will reflect that changing need. So it is definitely part of a big policy reorganisation of the way we do things. We are going to have to look at improving the way home care is funded and the way that home care is delivered. Part of that will be through pieces of work like what I took to Tynwald earlier this month, actually, basing and reframing the entire conversation around nursing and residential care. So there are lots of big strategic changes coming, which actually will hopefully push us in the right direction in terms of meeting that demand and meeting that need. But there will always be a need for new facilities. So there will always be a need for a facility in the north where some residential care can be provided. It's just likely that type of residential care provider will be more focused towards that sort of dementia care, long-term nursing care, rather than the sort of services we currently provide, although there will still be a demand for those services. It will be a bit smaller, and so the situation really is exactly as I've outlined. The long-term plan for replacing the facility hasn't changed. The scope of what we may want to build has changed, because we know a bit more now than we did 5 years ago, pre-COVID. But actually the biggest change really in that time has been that cost increase and being pushed down into the project development route rather than simply having a build approved. So that was the trigger point really for us revisiting the decision, and ultimately that's where we are. But the situation remains that we will be replacing the facility.
So the analysis isn't specific to the island, it's more global research that's been compiled?
Yeah, so we have commissioned a piece of work from Public Health looking at our ageing population and the particular care needs of our ageing population, because that will show us, for example, the level of care that might be needed, the acuity of people, the sort of need that we're trying to meet. That will help inform our very specific local decisions on exactly what provision is needed. But the evidence, like I say, is pretty well established. If you talk to anyone that operates in the sector, will tell you this is the direction of travel where things are going. The key question obviously for us is going to be how you properly resource that, how you properly train staff, how you make sure that the market can cope with what is coming with that change. Because I think if we were to try and do it tomorrow, the market isn't ready. We don't have enough home care, we don't fund people in the right way, we don't have enough support available, and I think anyone who tries to claim otherwise is living in a fantasy land. It will take us time to move that provision from where we are to where I think we need to be. And that's kind of part of building this new facility is part of that journey, is part of that puzzle as well.
And obviously, you've kind of mentioned a little bit of what I was just going to mention there. The Isle of Man is known to have an ageing population. People say there's a housing crisis, and there's also a distinct lack of health and social care staff. So if the intention is to offer care in people's homes, are you confident that there is going to be that amount of resource to be able to meet demand?
I'd like to say yes, but I think the reality is it will all depend on how much funding we are able to squeeze out of our treasury, and this is a big question that always hangs over me, I think, when I'm thinking about some of these things. Even if we want to carry on doing what we're doing, and I think we know that residential care is quite an expensive way of providing care, in order to reorient the system away from this kind of reactive, expensive care that we currently provide into something more proactive that helps people live at home for longer, helps people retain their independence, that will cost money. There will need to be investment in those services, and I think, as we know, the health service on the Isle of Man is not funded to the degree it needs to be funded. That is a situation that's been the case for quite some time. It's a situation that I'm trying to resolve, but ultimately it isn't something that is entirely within my gift. So whilst I think within the health and care system we're quite clear on where we think we're going and what we think we might need, ultimately we will be constrained by the ability of government in a broader sense to provide the necessary resources to let us do that.
And we've talked about the future development a little bit. I mean, can you tell us any more about those plans? Is there a kind of even ballpark figure date as to when that would the redevelopment would be in place?
Like I say, we are still going through that Treasury process. So at the moment, I'm not really in much of a more informed position than I think you are in terms of where we are on that journey. As you know, the original plans got all the way through to the kind of planning permission stage before things changed. It will take time, I think, in order to make sure that we do this properly. Ultimately, we can't do this in isolation. This needs to be done in consultation with residents. It needs to be done in consultation with staff and with the local community. This shouldn't be a decision that Manx Care just takes unilaterally. It has to be a decision that is taken with everyone involved and on board, which is sort of how we did the first decision, if I'm honest. The people were had opportunity to see the plans, to talk through them, to understand them, to provide some reassurance. And I think originally, generally, people were okay with the idea of closing Cummal Mooar and replacing it with this new facility. And I just want to try and reassure reassure people that that plan hasn't changed. We are still intending in the future to do that. It's just actually what that new facility looks like is what's changed. And so now we do need to go through that process of engagement with residents, with staff, and with the community to make sure that what is proposed is going to meet the need and is going to be fit for purpose. And that process will take time. It will need to be done, I think, quite sensitively. And I think the challenge we have now is just providing people with that reassurance that in the meantime, while that is going on, the department's position is nothing should change.
I mean, these plans have been in place since 2018, so 5 years for them to come forward. I mean, can you give any reassurance that it won't take another 5 years to come forward and then be put on hold again?
Unfortunately, I can't, and that's the problem I think when dealing with capital projects of this nature, and especially through the government system, is it does take time to do these things. It does take time to engage with people. It does take time to then go through the capital process that is set out by Treasury. It does take time to get funding approval. In some ways, I think I'm reassured that Treasury has a new funding process that lets us go to Tynwald, I think it's 4 times a year now, instead of just during budget season. And so there is the ability to do things quicker now than we used to do them. So it shouldn't take that long. We already have a good plan, I think, for what was originally proposed. So if all we're doing is reworking that original plan, we're not starting from scratch. It shouldn't take us the same amount of time to come back to the table with new proposals. But I'm not in a position to give any guarantees as much as I'd like to because of those broader funding constraints that I just talked about.
Okay, and any decision to close a care facility always has significant impact on those who use it, the families, the staff. We understand that the Executive Director of Social Care has called a meeting on the 23rd of August. Why do they need to wait a month to discuss any concerns that they have?
That's a really good question. So I found out about that obviously when I saw the letter that had gone out to residents. Personally, I think they do need to engage much earlier with staff, with residents, with families and with the community about what's going to happen. I think from my perspective, because as a department we're going to try and provide that reassurance that says nothing is going to change in the short to medium term. I mean, Manx Care talks about a 2-year timetable. My view is it will take longer than 2 years, so we need to make sure that we are committed to that facility for as long as needs to be, but longer than that 2-year period at least. So because this is going to be a longer process, I don't think we want to rush things, but equally I think you're right. I don't think it is really okay to tell people actually you've got to wait another month before you can sit down and talk to people. I know Manx Care did provide some contact details on the press release that was sent out, so that if there are staff or residents down there or families who want to talk about the situation, they can contact the people on that phone number, which I think was the MCAL's phone number they gave. But no, I've been talking with Manx Care quite a lot today about the way that they engage with staff and the way they engage with residents and their families to make sure that people are fully informed and on board and involved with any new process that's going ahead. So it is something I'm going to pick up with Manx Care again over the weekend and into next week to make sure that this thing doesn't drag on, that actually people are given the reassurance that they need as soon as we can give it to them.
Okay, and so, I mean, do you think that Cummal Mooar could stay open longer than 2 years? Because, I mean, you've just mentioned we don't have very many health and social care staff enough to be able to go into people's homes. Is there enough capacity in other homes? I mean, will Cummal Mooar stay open for more than 2 years likely if the proposals for the redevelopment haven't been finalised and we're not in a position where there are an influx of staff that we can actually deliver care in people's homes?
So that is the department's position. I mean, the facility itself is not compliant with modern standards. I mean, that's just a given. We know it isn't. So in a perfect world, I think you wouldn't keep running the facility. There is capacity in other homes in and around the north, in and around Ramsey, and I know there is. I've talked to some of the care homes directly, so there is capacity up there for people who are wanting to stay in the north, who actually may not want to use the facilities in Cummal Mooar. But from my perspective, like I said at the start of this, it is the department's position that facility should remain open until such time as a replacement facility is built. I don't think it makes sense to close down that facility and actually move residents out to other parts of the island, for example. I don't think that makes sense. I think it makes much more sense to say, let's have a plan, let's get the new facility at least constructed, up and running, and then you can keep people in the town that they obviously want to stay in. They've made a conscious choice to stay there. So yes, I think it is entirely possible the facility can be up and running for as long as much longer than 2 years, as long as it needs to be in order to make sure we get these plans over the line. The other thing I would say though is I want to get these other plans over the line as quickly as possible. So it may very well be that 2 years is an appropriate time frame, but it will depend, I think, on how long it takes us to get these revised plans up and running and through the system and out the other side. But just to reiterate again, the department's position is that facility should remain open until such time as a replacement is ready to be occupied.
I know that you said that you're going to be talking to Manx Care about how they engage with staff and residents, but Manx Care says there are going to be no immediate redundancies for staff. But if staff know the facility, they could not have a job in 2 years. I mean, why would you expect them to stay when there's no job security there?
I mean, 2 years is quite a long time, actually. And like I've said, I think 2 years is quite an arbitrary timescale to give. Everyone's known for a long time that the replacement facility is coming. I think if we can provide staff with the reassurance that there will be a replacement facility, clearly that facility will need to be staffed. And so I don't really see myself any particular risk in that space, because when we do build that new facility, we will need staff to run it, and it's just staff will have to move obviously from the current building to a new building. I don't think that situation has changed, and that's been the situation for quite some time. Even with the original proposals, the plan was to build a new facility and demolish Cummal Mooar, so those staff would have had to move over to the new facility anyway. So in terms of giving staff as much surety as I can, obviously I'm not the employer, but the department's position is very clear that the facility as it currently is should remain open until the new facility is built, at which point I would anticipate that staff will be transferred over from one to the other, exactly as was originally proposed, as far as I'm aware.
So that's the department's hope, but I mean, in reality, is that likely to actually happen? I mean, because we've heard stories from some of the employees that they're like 19 years old, they've just started working there. I mean, with that lack of job security and the kind of uncertainty of knowing whether the Cummal Mooar is actually going to stay open for longer than 2 years till the redevelopment is ready. I mean, in terms of like career progression, if they're just sat on hold, are they going to want to move to another sector? So
again, I'm not really sure where the uncertainty is. I've told you about 4 or 5 times already the department's position on this.
Yeah, but I'm just saying that Cummal Mooar at the moment says it's going to be closing in 2 years. It could be longer for the redevelopment to happen. The department wants the Cummal Mooar to stay open until the redevelopment is ready, but can that actually happen? Like, if that doesn't happen, what happens to the staff?
I think I'm a little bit unsure as to why that wouldn't happen. The department's position is quite clear.
Okay, but Manx Care don't get a say in whether it closes then?
I think the way that these things work is Manx Care deliver services on behalf of the department. So in terms of the way these things are drawn out, we have a mandate that says exactly how services are provided, exactly the level of engagement Manx Care have to provide with us, with residents, with staff, and the position of the department on this particular issue is quite clear. The other thing I would say, though, is there are quite a lot of vacancies across Manx Care, not just in health but in the social care side as well. So in terms of job security, I would strongly suspect that even if the absolute worst were to happen, then there will be vacancies within Manx Care that people would be able to take up. So I'm as confident as I can be that I think we are going to get the outcome that we want from this ultimately. I'll know more next week when I've had more chance to engage with Manx Care and to engage with the staff in the Department of Health over this, but my position on this is quite firm, that actually that facility, there isn't an immediate need for it to be closed. I think it's always intended. I think the 2-year timetable was already originally aligned with when the new build was expected. I don't think we're changing the position at all to say that the facility should remain open whilst the new build is constructed. Unfortunately, because of the process we've been forced through almost by some of those Treasury decisions around funding, that timescale is longer than anybody would like, but I don't think the position in and of itself has changed.
Thank you for making it to the end of the Little Manx Radio newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.